Hello and welcome to another Save Your Sanity live stream. I'm really excited today to bring you Dr. Hassan Tetteh. He's been on the podcast before. You may have listened to his episode. I hope you will. And we're going to be talking about his book, The Art of Human Care. This absolutely lovely book here, which is a lovely compilation of fine words and beautiful art. And we are going to be talking about the subject on the screen, which is helping your doctor hear the depths of your stress and anxiety. Welcome to this live stream, Dr. Hassan.
Oh, thank you, Rhoberta. Thank you so much. Pleasure to
You
be
are, yeah, it's exciting. And just as an aside, we were going to do this last week, but in the way of these people who keep you alive, he went and gave someone a new heart during our time span. So we're really glad that we could have you here today. I want to tell everybody a little bit about you. Dr. Hassan Tetteh is a U.S. Navy captain and associate professor of surgery at the Uniformed Services University of the Health Sciences and an adjunct faculty at Howard University College of Medicine. And he has a specialty in thoracic surgery. He leads a specialized, my goodness, a hard word to say today. He leads a specialized thoracic adaptive recovery team in Washington, D.C., and his research in thoracic transplantation aims to expand, we like that, heart and lung recovery and save lives. So we are focused on healing, we're focused on recovery, and we're focused on living fully, which is a wonderful thing to do. So I know that from your side, you'll have great answers to these questions, especially in light of your book. And from the other side, patients have questions too. So if you have a question, put it in the chat box, and as it is seen, we will incorporate it into the Facebook Live today. So when a person goes to the doctor, this whole phenomenon, I am really having trouble with my mouth today, this whole phenomenon of the white coat factor, our blood pressure goes up, our anxiety might go up. What do you do to allay those fears?
Yeah, that's a very good question. So I have a white coat on right now, actually. And I feel the same way when I have to go get my own physical. My blood pressure goes up, and just even though I'm in the business, so to speak, it just happens. I try and calm down as a patient, but I know that's not very easy to do. So from the physician standpoint, what I do for my patients is try to give them the opportunity to tell their story. That's one of the things I really write about here. And your theme is so appropriate, helping your doctor hear the depths of your stress and anxiety. And so the key word there is hear, right? When you can hear, you must be listening, or you should be listening. It's not enough to just hear, you have to listen. So that is really what I do. I try and listen, Rhoberta, to the patient. And, I had great professors of mine, and over the course of my career, it's been reinforced that if you just give the patient, the person that's seeking your care, the opportunity to tell their story, and you listen to them, you actually can be very efficient with your visit, and you will actually find that the engagement, the encounter is a lot more rewarding than if start bursting out with a bunch of questions. It raises the anxiety level of the patient even more, and they're never really able to come about to the point of being able to tell their story. And it doesn't take a long time. I think that's the misconception we have in healthcare. We're busy, busy, busy. We're running around. We only have 5-10 minutes to see with this, sit down with this individual. And so we think that we need to get the answers to our questions, in that time, and then move on. When reality is, we need to understand why that person's here, because what it may say in the report or the docket before you come in, it may not be the real reason why people are there. And you know this very well, which is why you cleverly put that, the depths of your stress and anxiety. We know this in healthcare, that many patients come to us, whether they're seeing their orthopedic surgeon, their psychiatrist, their surgeon, or their internist, that they're coming to them because they actually have some anxiety and they have some stress. And it's not really because of the ailment that's potentially out on the paper. And it's up to us to sort of help uncover that and not necessarily be the person that deals with that, but to understand that and understand how that's playing into the illness, the condition, and the reason for their visit.
So important, because then you get not only the verbal narrative, but you get the verbal cues in their voice, you get the look on their face, you get the muscle tension in their faces, you see their body shifting, you see where they brighten, where they frighten. All of these things can be taken in when you are just listening. And I think the distinction between hearing and listening is one is done by your ears, but the other is done when your brain is engaged with your ears. Right? So we're not just putting in time, yes, yes, I hear you. We're actually listening, and that means leaning in and really
Correct.
being curious and interested and present.
And
To
present.
actually be present, because you brought that up, that when you know that you're expected to only have a short time with someone, some people have difficulty actually being in the room they're in. They're already on their way to the next one, aren't they?
Absolutely. And that, again, it makes the visit really inefficient, and it just actually leads to more utilization, another appointment, sending the person to another doctor, and it just gives everyone sort of the runaround, and it's just not really a great use of time. One of the exercises I like to do when I have the opportunity to speak to audiences, especially in the pre-COVID era, and have an opportunity, no matter how big or small the group is I like to do a little exercise that I got from one of my great colleagues, Dr. Maples, who gives you an opportunity to really understand how important listening is. And he does this exercise called stepping stones. And so I'll tell the audience, all right, we're going to, have a moment that you're going to find a stranger in the room. So there's a little bit of musical chairs that goes around. You find a stranger, someone you don't know. And I tell them, you have 2 minutes to tell this stranger some stepping stone story, something that was so important in your life, something that dramatically changed the course of your life. It could be going to school, it could be having a granddaughter, it could be having a child, it could be the trip you took to Nepal. And you tell that person, and in that 2 minutes that you have, in that space that you have, the person listening to you cannot interrupt you. They cannot interrupt you. And that's like the hardest thing for people to do, because most people will hear, oh my gosh, you went to France? I went to France. Let me tell you what happened when I went there. And then, the whole conversation gets derailed. So those are the rules. Sort of the ground rules. You have 2 minutes, and then we reverse, and then that other person will have their opportunity to tell their stepping stone story. And so, Rhoberta, it's a fascinating exercise, because I never give people 2 minutes. I usually give them just a little over a minute. And do you know, almost 98% of the people have finished telling their story. Now think about this. In that time and space, in under 2 minutes, they're able to tell a very important, critical, life-changing, aspect of their life. And if you think that they can do that in that space, and the reason they're able to do it is really because no one is interrupting them. They're able to tell their whole story. They're able to get that out. And when they get that out and that person is listening, one of the other things I throw in there is that I want that person to summarize what they heard, so that, you can get this mutual understanding, and they have a minute to do that. And of course, I compress the time in reality, and I don't tell anyone until after. And it's just amazing. And everyone is just like, oh my gosh, I learned so much. I mean, people have become friends, especially in conferences where you meet a perfect stranger and you tell them this, life-changing event. Now they become like a, conference buddy with them for the rest of the event.
They're
So
bonded.
they're bonded. Yeah. So, I mean, if you carry that, sort of disposition, that sort of, idea and that thought, into your patient encounter, whether you're the doctor, you're the nurse, you're the tech taking the labs, or even, taking the vital signs, I think that you really get to understand and appreciate why the person is really there. And as you mentioned, it gives you sort of this cue to be present in the moment. Yeah.
Absolutely. And, following on that, there is research that shows that we are so used to being interrupted, and we feel so badly when there's silence, the research shows that if you fall silent in a conversation, and because I work with people who have been emotionally abused and been in relationships where they really haven't had a voice, I tell them frequently, the research shows that if you fall silent after you finish speaking and you don't fill in the space, the other person is most highly likely to become uncomfortable within 8 seconds and start speaking, even if they have nothing to say.
Nothing to say. That's right. Yeah. You have to do, yeah, that is key. You have to be a little uncomfortable with some silence sometimes, but you'll be rewarded at the other end.
Exactly. So when you give someone that silence to think, what would I like to say next? Or maybe they're struggling with which part of the story to focus on, and the doctor doesn't jump in and say, well, is that it? But actually can honor that processing time that that patient needs, that can be a big help too, right? And so there are cues and clues here for all our relationships, but particularly today we're focusing on, what can you do to help your doctor hear just how anxious and stressed you are? Because sometimes also, and I want your take on this, is sometimes we feel that we downplay what's going on with us because being able to be honest and vulnerable about the depths of what we're experiencing is difficult. We want to make lighter of it.
Right. It is. There is also another technique that, if patients are comfortable with it, and not many patients are, is to just say from the outset, doctor, I am very stressed and very anxious. And that hopefully may prompt the physician to sort of, okay, well, let me receive this information in a different way with that lens and that context of, there is a stress and there's an anxiety here. Let me listen to what is the cause of it, and ideally, how can we help work together to alleviate some of that stress and anxiety. So that's another cue for a patient. If you can kind of muster the courage up and overcome the white coat fear and anxiety, or even just make light of that and say, hey, the white coat really gives me stress and anxiety. I get very nervous when I'm around doctors. When I hear that come from patients, and that often I do, I immediately try and put them at ease. Oh, well, relax. You want me to take off my coat? I'll take it off if that's giving you too much stress. But I really want to listen to your story. I want to hear, why are you here? And I genuinely try and make them feel comfortable to open up and really tell me why they are here.
Mm-hmm. And I just want to make the point again that when you go to the physician, you're there because you really want them to know what's going on. And
Absolutely.
don't think that whitewashing your symptoms in order to sound like you have it together or sound like it's a small thing when it's really been top of mind for you and really bothering you. I like what you said, Dr. Hassan, to just say, okay, top of mind for me is I've got high stress and anxiety, and I can hardly know where to put myself. And when you can be that open, when you can be that clear, and you can begin the conversation with what is actually top of mind, all of a sudden you can breathe. And
Mm-hmm.
then you can continue the conversation. But if you're kind of hiding that part, like us, not, good people don't have the level of anxiety and stress that I have, so I'm going to downplay it. You don't give your physician the opportunity also to hear that and take it seriously.
Absolutely. Or be in a position to be able to help alleviate that stress and that anxiety. So
And
you're
they may need to give you a referral. Many times I've had many referrals from physicians over the years that this person is so stressed, and it doesn't have anything to do with their diagnosis. It has to do with their home life. It has to do with their relationship. It has to do with their background. And let's partner in order to help that person with that side of it while we shore up the physical side of it. So we get the mind-body connection partnered up.
Yes. I'm so glad you used that word. So you've been reading the book. So as you know, I have these principles, and I think we're espousing all of them here. What's the purpose of your visit? That purpose of your visit is to be heard from your care provider. You want to hear, You want them to hear what's wrong. You want them to listen to your story, and you want them to address, the issues that you're dealing with. This is why you seek out the professional. And from our standpoint in the health sort of world, we want to personalize our visit to each individual. Everyone is different. Everyone has a different story. So I may see, 12 patients that have heart disease, but every one of those patients is not a heart disease. They are an individual that has a heart problem, and they happen to have the heart disease, but they are an individual patient that has a host and a myriad of other things that are, one, contributing to their heart disease, but also two, that things that I need to understand and appreciate so that I can best treat their heart disease. One patient may benefit greatly from surgery, and another person may do much better with, medication and potentially rehab and things like that. And then there may be patients that have a need for a combination of all of the above. So that's very important. And then to kind of come back to, that third P of the principles of purpose, the personalization, is that word, that very important word that you said, I think is the magic elixir to move mountains, which is partnership. Because nothing great can happen when one individual is only doing that. The great companies and countries and societies have all had to rely on partnership, and that's no different in healthcare. I think we all know, and certainly I do in my profession in cardiac surgery, that it really takes a whole team to get a patient through a big deal surgery like heart surgery. But I also realize that there's a partnership that exists on the level of the sort of relationship between the patient and myself. And what I would do immediately when I recognize that I need help is to enlist the help and the support of my colleagues to help bring the patient to a place where they're not so stressed, not so anxious, and then they're able to sort of get their problems resolved as best as possible. So partnership is very, very important. And I think that the patient that's looking to seek care from their professional should look at their doctor, their healthcare professional, as a partner, and sort of helping to realize, a better place and a better state of mind and being, to get to that place, they're going to have to partner with each other. So.
And that's really important for people to really think about. Do I think about my physician, my specialist, my primary care? Do I think about that person as a partner, or is there an unequal relationship? Because I'm the expert on my life. You're the expert on how bodies work. So we have a partnership that only helps us if we treat it that way.
Sure.
I was telling you just before we went on air that I was diagnosed and sent to a specialist, and the specialist said, well, I want you to have this particular test. And it had to do with my lungs, and he wanted to do an open lung biopsy. And I've previously had a bilateral pneumothorax. So I said to him, what do you think would be any difference in the prognosis of this VATS for someone who's had a bilateral pneumothorax? And he said, well, you have about a 10% chance of being on a ventilator for a while. And I said, thank you, no. I do not want to have that experience. I also do not want to relive chest tubes and all the things that I've been through. And his response to me was, well, you're going to die anyway, so don't waste my time. And I said, on the contrary, what I actually said to him, Hassan, was, on the contrary, you are not going to waste my life. You're fired. And I walked out. But that idea of you do what I tell you to do, and I am not the least bit interested in any concern you might have, was the end of any possibility of partnership.
Mm-hmm. Yeah, no, that's absolutely true. And you're being an empowered patient as you are. You also know that when you take care of your patients, one of the things that is foundational to having a good partnership is that element of trust and the feeling that you are indeed a partner with them. You're helping them address their problem, and in turn that person is helping you to provide the very best care. But that has to only happen and only exist when there's an element of trust to begin with. So it is not uncommon, and it should not be out of the realm of necessity, and sometimes absolute necessity, that the patient says, this is not the doctor or this is not the healthcare provider that for me. And you should always feel within your right to say, I'm going to try someone else that may have better chemistry with me, one that trusts me, and then one that I can work with as a partner, because that is very important. It's very key. You want to
Well, I
have
certainly,
the right
yeah,
foundation.
exactly. And I certainly didn't want somebody with the mindset you're going to die anyway.
Hmm.
I mean, we've already got a predetermined outcome in a predetermined period of time that went along with WebMD, like old old research that says, in this number of years you're going to likely die. Well, I don't ascribe to that. I'm unique, and I know that I'm very healthy aside from this. I don't have a bad diet. I don't have all of these things that might mitigate that happening faster. And
Hmm.
this person had no interest. So I think that's a very important thing. So, in that case, what would you say that if I had had a different turn of mind than I had, which was highly unlikely, but if I had had a different turn of mind, or someone did, how could they engage their physician in not being in the next room while they're sitting with you?
Yeah, very good question. One of the questions that I think does bring the ability of, of the patient, another empowering patient, is a sort of a pearl of wisdom I would give is, sometimes we get a lot of the information, right? When we're the doctor, we get a lot of information from the patient. But when you're the patient delivering all of this information to the doctor, and you get the sort of the return, in your case, as you did, well, you're going to do this, that, and the other thing. You can feel like, oh my gosh, that kind of took me off. I didn't want to come in here and have this imbalance of power, if you will, like you said. I wanted us to be like on equal footing. I wanted us to be partners in this. One question that you can ask your provider, and you could have asked in this case, it would have been interesting for you to ask this question and see what the response is say, doctor, as a patient, they tell you what you need to do. You have to do this, you have to take that test, you have to do this, that, and the other thing. And say, doctor, if you were me and you understood me, and you understand my background, my health condition, my previous medical history, the previous surgeries, and the experiences that I've had, what would you do if you were me?
Mm.
What would you do if you were me? And I've had that patient ask me that question before. And it was one of those things that abruptly, even in my own kind of like model of like, all right, I'm going to be here and I'm going to be present. It really makes you become more present, because you're like, okay, wait a minute. Oh, wow, I didn't think of it like that. Well, let me see. All right, if I were you, all right, now I have to kind of put myself in your shoes, right? And this is another thing I write about, and it's something that I think just comes from me sort of organically, because I was too a patient. I was this patient that almost died and had this, life-threatening illness. And so I always remember how that feels, from time to time I forget, but those kinds of questions bring me back to that moment of time and saying, oh, wow, I was you at one point. Not exactly you, but I was like you. I was in this vulnerable position. I was scared. I was anxious. I was stressed out. What would I do? And I think that's a really good question, because what it does is it hopefully it will engender the, sort of the human, aspect of this engagement to come out. And now the doctor is kind of put in this, position where now they're going to have to consider what would they do. And hopefully their answer is one that brings comfort and says, okay, well, if I were you, I understand. I would be a little bit anxious about it. And I would consider this path or that path. And this is what I would do. Yeah. It's a good technique to sort of bring the person into the moment. If you think they're not paying attention, or you really think that you haven't quite got your message across, you can ask that, and it would be very revealing, and I think kind of quite informative at times.
I think that's a great question. A question that I've also used is, tell me what you think of such and such. I'll say to
Hmm.
a physician. And that sometimes opens a whole new thing, because I'm very interested in holistic practices as well as allopathic practices. I want to know, I'm with a physician, are they going to honor the fact that I may want to have acupuncture and nutritional therapy, or any number of things? How do you feel about infrared saunas? To
Hmm.
be able to get a sense of, all right, I know a few things that I might be thinking of doing. I'd like to know what you would think of my approach to things, so that we can also gauge whether or not we're going to have conversations that are going to actually be equal in any way. Or if a physician in that example says, well, I'm not dealing with any of that stuff, it's the science, it's only the science. So we get those situations where we could just ask a question. The one that you asked for sure is, what would you want to know, or what would you be thinking or feeling in my situation?
Mm-hmm.
And then just to ask your questions straight up. Don't just get cowed by the white coat. Like they're up here and I'm somewhere down here, somewhere down here, and I am not allowed to ask questions. Of course you are. It's your life. It's your future that is in their hands, and you are partners in this. And as you called it, the synergy of partnership in the book. We're talking with Dr. Hassan Tetteh, and he has written this wonderful book, The Art of Human Care, and you might want to have a look at it. I've read it. It's an excellent book. It is a very easy read, and it's also very beautiful because it's full of artwork. But Dr. Tetteh is really interested in humanizing the experience that we have when our bodies are performing in less than optimal ways, and we go to someone and ask for their help. And that's a very basic thing to do, to learn that we are vulnerable and we go to someone else to ask for help.
Absolutely.
And sometimes that very basic vulnerability is not even present. Sometimes we're afraid. Sometimes we don't want to go. How many times have we heard women saying, I just couldn't get him to go to the doctor. I just couldn't get him to go. Right? What do you tell people in that situation?
Well, yeah, you raise a very interesting question. What do you do? And sometimes I'll have patients that come in with their families. I like that. I mean, so as long as there's like a trust and there's a welcoming, aspect of that. I don't want the person to be there trying to bully the patient into telling them things. But what it's good again is it emphasizes this partnership, right? We have spouses, we have significant others, we have people that are family members that care about us. And sometimes they're able to offer unique dimensions of things that may not always just come out organically in the visit, and they can also give you some confirmation. Is that really what's going on? And then the person, no, absolutely not. He doesn't do this or she doesn't do that. And you can play out that some of that dynamic. But what you're saying is really important. It's this aspect and this element of bringing other people into, bear on how to help the patient that's in need, that's vulnerable. And so I leverage it whenever I can, if the all parties are amenable and the family members are there, because it can bring sometimes a unique dimension into the root of the problem, or at least aspects of the problem. But it is unfortunate that we too also have, and we see it a lot in heart disease, where you'll have a person that comes in, they succumb to a heart problem, or they'll have an unfortunate course of events in the hospital. And then when you talk to the family members after, you're like, he was not feeling well, or she was not feeling well for weeks, for months. This has been going on forever, and I kept telling them, go to the doctor, and they just didn't want to go. Now, I understand that, because I know patients just don't like the hospital. They don't like doctors. But if you're that loved one that's in that position where you're recognizing that there are aspects or things that are not going well, try and implore that person to go. Tell them that you really care about them and you want them to be around much longer. And perhaps if we can get ahead of something, and we go seek some professional help, that maybe you can be around a lot longer. Maybe use that as a way of enticing and then sort of motivating the visit, as opposed to like, you need to go see the doctor. Yeah.
Well, and also future pacing your life, like you're suggesting, but take it a little bit further. Like, we have a lot of things that we want to do in this life, and this is the little piece we need to take care of to move on to those things. But if we don't take care of it, it's going to perhaps get larger. And if it isn't going to get larger, we should know that, so we stop worrying about it and stop having it as a concern. So let's go fix that.
Yes.
let's get that answer. So important. So many things to talk about, but it is really insightful, I think, for everyone to hear you talk about it from the point of view of a specialist and a physician in a particular discipline, because even if you're going to your primary care person, they can't direct you to where you need to go unless they have actually heard you. I recently, my doctor left, my primary care doctor left, and I had to choose another. And I went, and he said to me, well, have you had a physical lately? And I said, no. And he said, well, we'll call this a physical. And so we did whatever we did. And he failed to come anywhere near me. He sat on a chair about 6 feet away. And so at the end of the visit, I went to the office of the hospital system. And I said, could you please give me the criteria for having a physical? And they did, and I said, well, I certainly hope I'm not being charged for a physical, because none of those things happened. Lo and behold, I was charged for a physical, ended up having to talk to the executive assistant to the president of the hospital, the CEO, and I was not charged for it because he went nowhere near me. So remember that patients have rights too, that the more informed we are, the more informed we can be about our care, but the more informative we can be for our physician. We want to engage in that kind of synergy of partnership as you write about in your book.
Yes. Well, you are, no question, an empowered patient. So you are absolutely the right, ambassador for this theme and topic of helping your doctor hear the depths of your stress and anxiety. Absolutely. Yeah.
Well, yes, I am, but I was going into medicine, so I had a leg up there. But thank you so much for being with me. It's been a pleasure to have you again for my audience. My guest today is Dr. Hassan Tetteh, and as you've seen, he's the author of the book, The Art of Human Care. You can find him, as I have shown you before, at drtetteh.com. Here it is for you. drtetteh.com, drtetteh.com. If you'd like to get in touch with me, you're having some emotional issues, or you're in a toxic relationship, come on over to forrelationshiphelp.com. And if you'd like to hear more about those things in podcast form, go to Save Your Sanity Podcast. Thanks again, Dr. Tetteh, and I'm sure we'll talk again.
Rhoberta, thank you. It was a pleasure and an honor. So much appreciate your time and the opportunity to share with your audience.
Thank you so much. So tune in. I'm glad you were here. And as I say at the end of every broadcast of every time, be really good to yourself, because you matter. Talk soon.